My name is Miranda. I'm an occupational therapist, and today we're going to be taking a look at occupational therapy within the setting of acute care. But first, I want to take a look at one of my favorite hobbies, which is beekeeping. On the screen, you'll see a photo of my bees climbing on their comb, me doing a hive inspection, and what a 3-pound package of bees looks like when you first receive it, which is approximately 10,000 bees. So there's different roles of bees within a hive. We have one queen, and her role is to lay eggs for reproduction purposes. 2% of the population is made up of male bees called drones, and they are mating with other queens within mating zones in the sky. And the remaining 98% of the population is made up of female bees called worker bees, and there are several different subcategories of worker bees. So we have nursery bees, guard bees, foragers, housekeepers. We have our architects that are building comb. We have our undertakers that are taking dead bees outside of the hive, and our HVAC system that involves bees that vibrate their bodies together in order to produce heat if it's too cold outside, or they're linking their bodies together, allowing hot air to travel outside of the hive if it's getting too hot. So why are we talking about bees? Well, as a beekeeper, any opportunity that I'm given, I will talk about them. But I also thought that they were a great representation of occupational therapists within the healthcare system. A lot of people know that bees exist. They might even know a fun fact about bees, like that they produce honey. But a majority of the population doesn't understand the subcategories of worker bees and how their role is vital for the health and survival of the hive. Similarly, a lot of people know that occupational therapists exist, but most people don't know what we do on a daily basis and why our role is vital within the healthcare system. So what do? Well, specifically in acute care, we facilitate participation in meaningful activities. So whether that's something small like being able to tolerate sitting up long enough just to brush their teeth, or something more involved like taking a shower. But we aren't just having them do the activity, we're setting up the activity in a way that addresses their barriers while also highlighting their strengths. We encourage early mobilization, which we understand is crucial for the healing process regardless of diagnosis. We determine the need for assistive devices and adaptive equipment, whether it be grab bars, shower chairs, sock aids, reachers. We help provide family and caregiver training to ensure that the techniques that are being utilized are keeping both the patient and their caregivers safe. And we also help to create discharge plans. So this is really big in the hospital. We do this by gathering information about prior level of function, home setup, what assist is available, and we combine this with our ability to observe and utilize standardized assessments to determine, can this patient go home, or do they need additional therapy services, maybe even a rehab stay. So let's take a look at Jim. He's a 78-year-old male, one day post-op, a right total knee arthroplasty. He lives with a spouse who's in good health and she's able to assist if needed. Prior to coming to the hospital, Jim was independent with activities of daily living. He used a single point cane to get around. Him and his spouse live in a single level home, so they don't have any stairs. It's all ADA accessible. His wife has noticed that he's been increasingly forgetful lately, and ever since his surgery, nursing reports that he's been acting a little bit silly, and he's only oriented to himself and the date consistently, but he sometimes needs reminders about why he's here. So the surgeon wants to know, can this patient go home today? So some things that I want to complete during my initial evaluation include manual muscle testing. Determine, is it even safe for this person to get out of bed at this time? He had great lower extremity activation, good quad activation, so I did determine that getting out of bed would be safe. I then want to see him complete bed mobility. So I'm laying the head of the bed flat, getting rid of the bed rails in order to simulate his home setup so that I can see him perform it in something similar to what he would be doing at home. He was able to complete bed mobility, but did require moderate assist for his right lower extremity secondary to pain. I want to know, can he tolerate the minimum household distance that's required for him to get to things like his bedroom, his bathroom, and his kitchen? Jim was able to ambulate this distance, but he does require use of a front wheel walker now rather than the cane, in addition to increased time, again, secondary to pain. Another thing that I really like to see is toileting, because it looks at several different aspects. One being, how is he able to manage his balance while he's utilizing bilateral upper extremities on a task like managing his clothing rather than holding onto a walker? How does he do with low functional surface transfers like getting on and off of the toilet? And what is his ability to initiate, heed, and terminate a task? Now, during toileting, Jim was able to complete the physical components of this task with use of a grab bar and verbal cueing for technique, but he had a really hard time with attending to the task and did require reorientation to the task as well. Now, given his performance on toileting, I also want to see a higher cognitive level task like medication management. So this is an example of a standardized assessment that I utilize within acute care often. It's called the MedTalk, and there's two parts to it. The first is a clock drawing and a 3-word recall. Now, Jim drew me a square clock, and he justified it by saying that it was a cuckoo clock. But he did forget to put the hands on the clock, which I specifically asked him to place to 10 past 11. The second part of this is medication management. So I asked Jim to organize 4 example prescription medications into a grid that represents a pill organizer. Jim had a really hard time with attending to this task, which did cause a lot of mistakes. And he also demonstrates deficits with flexible thinking because he was perseverating on the fact that these were not his medications. Given his performance on the MedTalk, in addition to the reorientation required throughout the session, cues me into thinking that he might be experiencing a little bit of delirium, especially given his risk factors such as age, recent surgery, and potential history of dementia. So, a treatment session with Jim. First off, I really want to do some education with both Jim and his spouse about delirium and what some of the things that we can do to decrease the negative effects of delirium, like having plenty of natural daylight during the day, getting him on a good sleep-wake cycle, and engaging him in familiar and enjoyable activities like listening to his favorite music or a good conversation with friends and family. I want to do education regarding his inability to attend to tasks, how this can affect his performance, and how it can also present as a memory deficit. I want to do balance tasks, both dynamic and static balance. There's plenty of activities that Jim needs to be able to do on a daily basis that require him to not be holding on to his walker. I want to talk about home safety modifications. So can they install a grab bar in his home, and can we also have him using a shower chair when he does go home? And then last, I want to guide his spouse in how she can supervise higher cognitive level tasks to keep Jim safe while not just doing the task for him. So why does independence in daily activities matter? Why do we have occupational therapists addressing this? By improving independence, we can also improve safety and decrease fall risks. And when people feel empowered and capable of getting up and caring for themselves, they're more likely to spend time out of bed, which in turn can decrease the negative effects of prolonged bed rest, such as decubitus ulcers, complications post-surgery, or even things like diabetes. And a combination of these factors can really impact the overall health and well-being of our patients. So why does it matter to you guys to know what it is that I do on a daily basis? Can you imagine if all 80,000 of my bees went about their day with little to no knowledge of the other bees around them? While work would probably get done, full utilization of the resources and the talents of the bees around them would probably be overlooked. So if we can approach other healthcare workers with a more open-minded, curious mindset, like trying to figure out on a deeper level what their role looks like, we also have the opportunity to approach patient care from a more well-rounded view. So I want to take the time today to thank you for listening to me speak, and I hope that you continue to learn about other healthcare providers so that we can continue to work more efficiently and collectively as a hive. Thank you.